Okay. Okay, welcome to the August 17th, 2020 meeting of the Haywood County Board of Commissioners. Our first order of business will be the Pledge of Allegiance, and after that I'm going to ask our chaplain, Reverend Josh Frazier, to come forward for the invocation. So if everyone please stand for the pledge.
Let us pray. God in heaven, we thank you for another beautiful day, another day that we are able to serve you, another day that we are able to make decisions on the things that you have given to us, the many blessings. Lord, what a blessing it is to be in this county, in this area, Lord, and such a beautiful area, God, and we thank you for that. We thank you for the beauty that it brings, Lord, the joy that it gives to each one of us in our hearts. Lord, each one of us are stewards over various things in our life, and we are coming here today, Lord, to make decisions and to influence, Lord, in a way that would be beneficial not only for ourselves, but for everyone. Sometimes we have differing opinions, and Lord, we ask that you would unite us together as a county, as a group of people, and that we would be able to live in peace and harmony as you would have us to do. And all the decisions that we make, we pray that they would honor and glorify you, which is the ultimate peace. And it's in your name we pray. Amen.
Thank you, Pastor Josh. Okay, their next order of business is called for public hearings, and we have none this evening. Our next order of business after that is our public comment session. I have several people signed up to speak, and I'll just go through them as they were given to me. I would just ask that you limit your comments to 3 minutes. Tracy will kind of remind you, and I don't mind you going over a little bit if you'll finish up your thoughts, but if you kind of keep going and going, and I'll kind of stop you. Sorry about that. But anyway, and then also there's some hand sanitizer, I believe, and some wipes there if you'd like to wipe the microphone and or anything like that. And then there's some hand sanitizer. So our first speaker will be Joey Reese. Welcome, Joey.
A hip or a knee that's gone out on her, so she couldn't get up here. So I'm going to do that, and then I'll have just a closing comment or two of mine. I'm going to read what she had prepared, if that's okay. Before you is a choice to support a local needle exchange program or not. I'm simply going to ask you rhetorical questions for you to consider in your decision. Number one, do you feel that you have the threat of extortion and intimidation hanging over your head as you decide this? The threat is that you will suffer a negative reaction in the local papers and media if you decide a particular way. Number two, do you believe that this program is expertly administered and clear objective metrics are established and measured so that we can determine if it has any chance of success? And I'll comment on that myself in a bit. Three, how would you and the community even measure success of this program? Would it be an increasing number of needles and clientele so that funding and support is justified? Number four, if the success of this program is to decrease drug use and homelessness, well, how are we doing with that so far? Is that working? Has it helped at all? Number five, do you subscribe to the idea that we should support any program if it includes like free money? No matter what the cause, no matter what the damage to the community, just because if we turn a program down and have to give money back, does that make good sense? I would say not. Number six, do you believe it's a conflict of interest for many of those that have direct, indirect, or political gains to also ask for support for this program? Number eight, has anyone made you aware that the town of Charleston, West Virginia banned their needle exchange program, finding that clients came from as far away as 109 different zip codes to get the free needles? And I'll talk on that myself right now. I called Kenny Berner today. When I was with Appalachia Heights, I was the deputy director of Tennessee. Kenny Berner was the deputy director of West Virginia. And I called him and I asked about this. I said, can you fill me in on this? He was the deputy director for 20 years after he retired first from the West Virginia State Police. And Kenny said there were two needle exchange programs, one in West Virginia and one in Huntington. Now, Huntington and Charleston, the entire state of West Virginia is the epicenter for the opioid epidemic. You think we've got it bad? We don't have anything. It's the very epicenter of the whole country for the opioid epidemic, has been. He said the one needle exchange program was in Huntington. It was administered and run by a physician, by a local physician that was there. When you came in to get needles, you had to be tested for hepatitis and HIV, which is supposedly one of the reasons for this. Even though the rate of transmission for HIV, the last rate I saw was about 8%. Most of it was still from unprotected sex. That was one of the programs. They actually, and they had people there for you to talk to, had programs for you to go into. They had a 33% rate of people that participated in that program of going into treatment. Now, that's not who came out of it, that's just going into treatment. Then they had a needle exchange program in Charleston. It was run kind of like this one here, I think. I think it's where you, you know, hey, John, how many you need? You need another 100, and you throw it under the bridge. All needle exchange programs are not created equal, as is anything else, and I know Commissioner Inslee was talking about the CDC. I think that the good statistics that are in the CDC that they were quoting come from needle exchange programs like the one in Huntington, not like the one in Charleston. And that's just it. Thank you very much. I will say, I've watched these programs a lot. I will say, Kirk, you know, we're on probably different sides of the aisle on many things. I appreciate your thoughts on this. You've really shown some leadership, so thank you.
Okay, thank you, Joey. Okay, our next speaker will be Janet Presson. And I will say, too, try to make sure you're talking to the mic. Joey did a good job, but make sure you're talking to the mic, because if you get too far away, you can't hear. Go ahead, Janet.
Thank you. I'm Janet Presson. I'm an RN here in Haywood County, and I wanted to talk about COVID and the continuing shutdown. Over the past 5 months, we've been told by the World Health Organization, CDC, North Carolina DHHS, Haywood Health Department, and Anthony Fauci, our legislators, or some combination of the above, the following. It's just for 15 days to flatten the curve, even though we're at 150 days plus right now. Masks aren't effective. Wear a mask. You only need to wear a mask when indoors when you can't socially distance. You need to wear a mask outdoors. You need to wear a mask indoors alone. You need to wear a mask when having sex. You may need to also wear goggles, as COVID may be transmitted through the eyes. COVID-19 can be picked up from surfaces, then it can't be picked up from surfaces. Pets may be able to catch COVID from infected humans. COVID may be in the ears. Hydroxychloroquine works, then it doesn't work. We desperately need ventilators, then ventilators aren't a good choice for most COVID patients. Wear a mask to protect others, not yourself. We won't be able to reopen the country until a vaccine is available. The COVID-19 vaccine won't be mandatory. The COVID-19 vaccine will be mandatory, and you won't be allowed to work or enter public places without proof you've had it. Masks will be required for the next 3 months. Masks may be required for the next several years. It's starting to feel like we're being punked here, but I think it's more likely we're being tested to see how compliant we are and how easily we will do what authorities say and how easily we will relinquish our rights. In fact, Joe Biden said it's not about your rights, it's about your responsibilities as an American, as he called for mask mandates for every American when outside for the next 3 months. If you want to wear a mask, please wear one. However, please do not try to shame those of us who will not. For starters, you have no idea just by looking at someone whether or not they have a medical or psychological condition that keeps them from wearing a mask. In addition, there is a huge body of scientific published research showing that masks do not protect against viruses such as COVID. Also, if you're really counting on a mask to keep you from getting something, don't be laying it on the podium here when you speak and then putting it back on your face when you're done. I've seen that happen at previous meetings. They put it right down here and then pick it up. And I mean, when more and more people do that, you know, how sanitary is that? You also can't stuff that moist mask in your pocket or purse or on the seat or floor of your car and then put it back on. Medical professionals throw out that mask every time they walk out of a patient's room. You don't re-wear. As for COVID, we're bombarded with numbers. Number of tests done, number of positives, number of negatives, number of people isolated, number of people quarantined, and on and on and on. Considering the inaccuracy of some of the tests and some of the results reported, the really important numbers are these two: number of hospitalizations and number of deaths. And then how do those compare to the same time period last year? Anxiety, depression, suicide, and substance abuse are skyrocketing here in North Carolina and across the country. And I mean, of course, those have been a huge problem in Haywood County. These were huge problems prior to COVID, and they have just escalated like crazy. This includes children. We must consider these issues and stop this overemphasis on a primarily mild virus that has a very low death rate. Thank you.
Thank you, Janet. Appreciate you coming tonight. Our next speaker will be Lisa Falbo. Okay, welcome, Lisa.
Hi, I am Lisa Falbo. I know that name's hard to pronounce. I am co-founder of the SHARE Project, along with Michelle Rogers, whom has spoken with you guys in previous commissioners' meetings. I have been keeping up, just a little side note, I've been keeping up with the commissioners' meetings through your online streaming, and I appreciate you guys doing that. That makes it very easy these days. I also want to commend the board on the last Monday morning meeting that you guys had. It seemed to me that it was the first real conversation that you guys have had taken place between you guys as it relates to addiction, and specifically the role that harm reduction and the different recovery programs in Haywood County have to offer. It also seemed to me at this last meeting that two different programs were pitted against each other. This doesn't seem right to me. I am a fairly bottom line kind of person. I like to go to the bottom line, work my way back up, and it seems to me that the bottom line in this addiction discussion is that addiction is treatable, but not if you're dead. Now let that just sink in a minute. The basic role of harm reduction is to keep someone alive so they can go get the treatment that's needed. That's the bottom line. If I were looking at it from a layperson's perspective, doesn't that seem like the logical order of things? Keep them alive, let them know about their treatment options, encourage them to get help, direct them towards that treatment, help them get into treatment. Now I realize there's a lot of things I left out there, a lot of details that can't be left out when making a decision. Details like the fact that overdose rates are continuing to climb, especially right now in this time of isolation and physical distancing. That is not numbers put out by harm reduction. That is numerous national organizations that report these numbers. In fact, just last week, nationally, overdoses were up 42% from last year. 42%. Details that, like right now in Haywood County, we track deaths of despair. Details like the fact that addiction is and has been recognized as a disease for several years now. In other words, if you take the clean needles away, that doesn't take the disease away. It's a disease. You just increase the possibility that they will never seek treatment and contract another disease. Details like the fact that funding to one of the only other crisis centers, the department in the Balsam Center, was just cut, forcing its closure. That just was in the newspaper just this week. Details like the fact that harm reduction has about 10 other programs that are more successful than the needle exchange program, and they are never talked about. Details like the LEAD program that has partnered with harm reduction has a success rate that actually saves the county money by keeping substance users out of the criminal justice system. Details like the fact that we are starting to make some advances in Haywood County when it comes to recovery and transitional housing, along with building relationships with the people that need it most. Details like the fact that there are now more grassroots efforts here in Haywood County that are making progress, and we are all trying to work together. We don't need these efforts pitted against each other. Details like the fact that stigma alone keeps people from seeking help. Let me define stigma for you. It's a mark of disgrace associated with a particular circumstance, quality, or person. Are you and I, as representatives of Haywood County, contributing to that definition? Discussion is good, and it should continue, but I hope it isn't just discussion, that it isn't just words you all are saying to keep the haters happy, because if that's the case, you are doing it at the expense of saving lives. Again, there's that bottom line. Addiction is treatable, but not if you're dead. Thank you.
Okay, thank you. Okay, our next speaker is John Lynn McDermott. Welcome.
Hi, I'm John Lynn McDermott. First of all, I wanted to say we have a community group. You can see it's called Saving Haywood. I wanted to first off state that none of us in this group want substance abuse users or people with substance abuse disorder to disappear. We don't hate them. We want them to get help, and we don't want them to be just swept under a rug. We're not haters, but we have a feeling something else could be done. Okay, the biggest criticism about most harm reduction methods is that in some ways it can be compared to enabling addiction. Many substance abusers are fully aware that they have certain safety nets that are provided by harm minimization programs. When they are protected from some consequences of their drug-driven behaviors, and they see fellow addicts are likewise protected, they know that they can continue to use with relative impunity. Looked at another way, these programs can appear implied approval of substance abuse, because in many ways they make it easier for active addicts to feed their disease. Clean needles, overdose, reversal medicines, sometimes free roofs over their heads, most of the rock bottom, quote-unquote, motivation necessary for change is lost, all in the name of reducing harm. So addiction can be prolonged by a notion of so-called harm reduction, but nothing will ever be done about the daily physical urges, the psychosocial and psychological factors that are a huge portion of addiction. As long as an addiction continues, the risks and harms continue to add up. Deepened dependence, physical and mental decline, broken families, generational substance abuse, and unfulfilled promise of life. Thank you.
Thank you, John Lynn. Okay, our next speaker will be Paul Yeager. Welcome, Paul.
My name is Paul Yeager, and I live in Waynesville. It's a little hard to understand whose harm is reduced by handing out needles. Now, I get it. It might help an addict to stay alive long enough to get treatment, but it doesn't guarantee that they will. It doesn't encourage them to do so. This appears to be referred to as a needle exchange program. And yet I've heard no mention of sharps containers. I've heard no mention of disposal of used needles. And I have heard from friends and neighbors about needles being found on the ground by their children. It would seem that this program is only helping that problem to be worse. Finally, the citizens of Haywood County count on you gentlemen to be careful stewards of our tax dollars, to spend funds on a program where you do not have any metrics by which you can judge the efficacy of that investment is not being a good steward of our tax dollars. Thank you.
Thank you, Paul. That's all the people that I have that have signed up. Would anyone else like to address the board? If you would, just raise your hands. Okay, lady right here in the front with the red mask on. And I'll get to, yeah, come on. If you would just state your name, where you're from maybe, and I'll get to the other that had their hands up. Welcome. You can pull the mic down there if you want.
My name is Diana Gordon, and should I start now? Okay. I no longer just want police surveillance cameras that were promised to me, but also police presence. Let me explain why. This bullying that is happening to me is an inside job. I hear the thugs come in usually after dark and leave in a few minutes of when I wake up. They are in the apartment over mine. This did not begin here in Waynesville. It started in Leicester 4.5 years ago. I had problems with several neighbors there. One, my chicken and rooster had been killed by a neighbor's dogs, and I took her to court. There were much more situations. Who are the people who are doing this in all the places I have resided? It has been the same category of people. It's the country people, those whose families have lived here before the Civil War. It's not the elderly, it's the young, 18 to 28. I believe some of them having gone to trade schools, learning electronics and more. When I was protesting last in front of the police station, one of these people came up to me furious that the people from the north were stealing her mountains. These people are angry. They see their lands and heritage stolen by developers who cut up their lands and build thousands of houses. They see taxes increasing and find it difficult to survive. Many are prejudiced and hate blacks, considering them beneath themselves. They hate me because I make waves and stand up for myself and what I believe. What do? They destroy everything I own. They're endless thefts. They intercept my calls, cancel my doctor's appointments, and steal important mail from my post office box. For example, my Social Security information and a letter from the ACLU. There are no security cameras in the post office boxes in North Carolina. Their families and friends live all across the state. That's why moving did not stop the harassment. This is not just happening to me. While protesting, others have told me this is also happening to their loved ones. I have signed statements from businesses and friends testifying to what I have said, and the police have copies, but they do not contact the individuals. You can get their names and phone numbers from them. I know exactly who started this, their names and addresses in each town. Their names are in my files at the Leicester Police Department, Maggie Valley and Waynesville Police Department, and the Haywood Sheriff's Department. As I have said before, I believe that the police are not helping me because I am a whistleblower. I had the largest crime watch in the second largest city in Rhode Island. I had several interviews on news and many articles in the local papers. Then I found out why the crime watch was needed there. There were 6 halfway houses in a 10-block radius of my home and business, and three drug clinics. They just sprang up. There were no rules, and early release prisoners were actually running them so as not to have to pay their rent there. There were no supervision. 2 were across the street from schools, which were actually illegal. They had sexual molesters in them. Why did they exist? It is extremely lucrative to own one. Plus, you can get grants. The police were using grant writers from one of the drug clinics to get grants for themselves. There were fights galore and drug paraphernalia all around. I never mentioned the halfway houses in my crime watch until somebody mentioned it in the last meeting. The chief of police said everything is under control. I challenged him and he just walked out. Everything I have stated here and more is filed in police reports that I have written, stamped, and copied. I will never stop protesting until this is rectified with police intervention. And what about the young police officer that accosted me here? He needs retraining at the very least. A transfer to another police station without retraining is not acceptable. I want a written apology. I also want you guys to help me somehow. I'll be going to the next meeting at the Alderman's.
Okay, thank you, Diane.
Thank you. Any questions?
No.
I didn't think so.
Okay, Ms. Paris. Yeah. I'll get everybody. Don't worry. Welcome, Jean.
Thank you. Thank you for having me here. I wasn't prepared to speak, but I could not resist. A couple of things that I have heard that are totally not true. Paul Yeager said he had never heard of Sharps containers. We have bukus of them. Some of them are laundry jugs or oil can jugs, and some of them are really Sharps containers, but they are all viable and usable. And we do have syringe disposal. We send them off to an incinerator in Charlotte. So if anybody has a question about that, you could question us. We do have disposal, and we do have boxes to store. Also, this lady just spoke. I would say to you that most of us in here are country people, and I was very insulted by your referral to country people as being the thugs. There are thugs in every group of people, and this is kind of like the blacks matter, whites matter, people matter, and country is good. Country people know how to grow food. Country people know how to go to church. Country people know how to care about their neighbors. And as long as you go with that attitude about country people, you will get no help in Haywood County. Go back.
Okay, thank you, Gene. Welcome.
Hi there, my name's Caitlin. Thank you so much for giving me the chance to speak. I'm a young woman who cares deeply about this community and each and every person that makes it so special. I've spent my entire life here up until I was 18 and I went off to college. Since then, I've lived in 3 different countries, traveled all over the world, but the people and the beauty of this place has finally found a way to bring me home. Since returning, I've made it my priority to attend these meetings, school board meetings, town council meetings, and pretty much any other type of meeting I could find to dedicate myself to the betterment of this town. Attending these county commissioner meetings has made me aware of North Carolina Harm Reduction Coalition and both the resistance and the acceptance of this program. I couldn't sit back here for another week attending these meetings without speaking up. I am a child of addiction, and my family was deeply affected by substance use disorder when my own parent sat on my bed on Easter Sunday and told me that he would be leaving for 6 months for a treatment center. My world stopped, and it hasn't quite turned the same since that day. But my story has a happy ending. My family member was the exception to the rule and thankfully made it through treatment, and they've lived a beautiful substance-free life for over 17 years now. But not all stories are happy endings here in Haywood County. Not all children of substance use disorder in Haywood County are as lucky as I have been. My intention in speaking up here today is to ask each of you sitting up here, our leaders that we've elected in this town, to take a pause, take a deep breath, have a genuine, transparent, and honest discussion about the resources that this program offers, beyond the tiny ones that some choose to focus on. Before a grave decision is made to remove a lifeline for many, I'm asking you, as a member of this community, as a child of addiction, please take the time to know exactly what you would be taking away. Thank you.
Anyone else like to speak? Right here, okay. Welcome.
I'm Patricia Frisbee Meyer. I too am a child and an adult of mental illness disorder. I grew up in a dysfunctional family with my father being an alcoholic, and it was very hard. But I hear everyone speak, and it's like you're playing tug of war with each other. And that's not what it should be about. You know, lives matter regardless of your color of your skin, whether, you know, you go to church or you don't go to church. But one thing I would like to say is when you're deciding on how this money is spent, think about what's truly being cut as far as the mental health system, where these people really need to go, not to an office or somewhere to, you know, be given what they need. Let them be referred to the Balsam Center. Let the Balsam Center be open. You know, with that being said, you know, it's a matter of a choice too that you can make. You either choose to stay on that track of being a dysfunctional person, or you choose not to. And thank God that I was able to choose not to, and I didn't go down the path that I could have gone down. And this October will be 2 years sobriety for me, and I'm thankful for that. August made 10 years completely smoke-free for me, and that was decisions that I made for myself, to better myself and better for my children and my grandchildren. But please think, when you go to vote for this, what the money really needs to go for. You know, mental health, there we go. You know, it has to be. They need the help there. And I was born, reared, and raised here, and I'm country all the way. You might take me out of this country, but you'll not get that country out of me.
Okay, thank you. But if you're country people like me, you've been doing a lot of canning, or my wife's been doing a lot of canning. I shouldn't take credit for that, but canners have been the chugging if we can find some lids. Would anyone else like to speak? Okay, come on up. Have you? Okay. Welcome.
Hi, Kelly Cashella, and as we all know, I'm here to speak against harm reduction. As I sit here and listen, I didn't come prepared with anything, but I've been sitting here making my little notes, and it makes my heart hurt. Everyone has the power over their life. Everybody. An addict, a drunk, you have that power over your life. And in some way, shape, or form, we've taken it towards our responsibility to take on their life. Addicts do have underlying conditions, but it's not addiction. We're here based on, we're fighting for the addict, the addiction process. That's not what we need to be here for. It's those underlying conditions. Would you give a thief keys to your house? Any of you? It's a legitimate question. Kurt's look, you missed that one, didn't you? Would you give a thief keys to your house? We're giving addicts needles. And we're not assisting with those underlying conditions. It doesn't help. Mental health helps. Medications help. Right now we have some factors. We have harm reduction. We have addicts. We have drug dealers. And we have the community. Who are we helping? Are we really helping the addicts? Or are we helping the drug dealers? Where's that line? But right now, how we're affecting our community is we're destroying businesses. We're taking the lifeline from our youth. We can't let them go out and play in their yards. If you live anywhere within city limits, that's not safe. Between the needles, between the addicts just walking around, it's not safe, folks. I understand these are people. They made this choice. Our children don't have that choice. And I will fight for our youth, no matter what. I hope you think about our youth and where we're going to be in 5 years. This right now is a Band-Aid, and it's going to bust. Thank you.
Kelly? Would anyone else like to address the board tonight? Okay, seeing no one, I'll close the public comment session, and we'll move on to constituent concerns. And I know Bryant had one. Bryant, go ahead.
Thank you, Mr. Chairman. Our contact from the Census Bureau couldn't be here, and he asked me just to review a few pieces of data with you guys, and maybe we could encourage people who haven't taken the census to complete it. As a county, Haywood County has had a response rate of 53.5%. We're 0.4% ahead of 2010, but we're still well below the state average of 59.6. So we need to close that gap, or we're going to lose money for the next 10 years, especially in formula grants from the federal and state government. Canton has had a response rate of over 60%, Clyde's at 54%, Waynesville at 58%, and Maggie Valley at 30%. So The census deadline's been extended through the end of September. Mr. McGowan will be here at the first meeting in September to review what can still be done, but it's really critical that people respond to the census. And I know with COVID, everybody's attention's been away from the census, but this is something that's going to last with us for 10 years. Of special note is Dogwood Health Trust has set up a grant project to pay nonprofits to help in the census. And for every person that they get signed up to complete the census in August, Dogwood will pay them $20. And then after August, it goes to $10 a person. I think you can find information if you're a nonprofit and you're interested about that on their website. But that's a good way to make some money for the nonprofit as well as help the county get the response rate up. That's all I have, Mr. Chairman.
Okay, thank you, Brian. You know, the census, it's interesting. I've been doing some genealogy research, and when you go back in time, I've been doing some research in the 1800s, and I was following my family, and every 10 years I kind of get an update on them. And that's what the census does. It kind of gives us an update on our country. But on my family, I followed my great grandfather, and every 10 years I could see when his kids left the home and when they were born and what their names were and everything, and what he did for a living, how much the value of his house was at the time, his real estate. So it's really interesting. So I would encourage everybody to, if you've not contacted not the CDC, the Census Bureau to try to get those papers in, because people will be coming around contacting you. So, but anyway, it's a really good thing. Okay, so we got. Is any other commissioners want to say anything? I won't call on you, but does anybody have anything? Constituent concerns that?
I don't have any. I just had a few comments and texts and phone calls about the harm reduction.
Likewise, I've had the same, along with some other constituent concerns that I've got with the staff on and Mr. Moorhead. So I think other than that, I'm good. I know that, Brian, I don't know if you want to give a short update on the communication part. I know we discussed it a little earlier. If you can tell them what the holdup is, just for any of those watching.
This is really for the microwave or simulcast system. All of the equipment's been ordered, delivered. We have it ready to go. We've submitted applications to the state. I think it goes through the Highway Patrol to allow us to co-locate equipment. We're waiting on them, but as soon as we get that approval, we'll be able to get it installed, and should take care of a great deal of the problems we've had with our communications.
Thank you.
Yeah, we did get some questions on that. Did you have anything, Tommy, that you wanted to say?
I had a couple, just some questions and comments and constituent concerns about some of the things people spoke about. But also had a couple about the county noise ordinance and specifically the Smoky Mountain Event Center. They lease the facility for birthday parties and other events to private individuals, and on consultation with Mr. Queen, as they lease that facility, the ones who lease the facility from the Smoky Mountain Event Center, they are responsible for adhering to the governor's orders surrounding COVID-19. And from everything that I have discussed with the Sheriff's Department, these folks do adhere to the county noise ordinance, 10 p.m. So I've investigated that, and it seems to be that everything is in order surrounding those events. So thank you.
Okay. Okay, I'll move on if anyone, you okay, Mark? Okay. Okay, so I'll move on to, I had some comments, but I'll just wait for when it comes up later on this, on the harm reduction. But we did get some information from the state, and I'm sure Ira will be going over that. Okay, our next order of business is administrative agency reports and presentations, and we have, today, we have Santac environmental update for the White Oak landfill, and we have Santac Vice President of Corporate Business Development, Ben Johnson, and Santac Vice President of Engineering, Ron Bell, here. So if y'all want to come up, and I just wanted to, this is just for everybody that maybe do not know, Santac runs our landfill and operates our landfill. We appreciate the work that y'all do. So welcome.
Thank you so much. It's actually just going to be me today, so I apologize Ron could not make it. Good evening. My name is Ben Johnson. I work with Santec Waste Services. I'd like to just first thank you all for having us, giving us an opportunity to speak about the landfill operations over the past 12 months. So we'll dive right into it. So first, we'll kind of look at the White Oak landfill annual volume. This past year, White Oak landfill received 159,793 tons. 71,376 of those originated from within Haywood County, and 88,977 tons originated outside the county. On to the annual host fee. The host fee paid to the county for 2019 and 2020 was $108,113.99, bringing the overall host fee total since 2014 to $626,354.08. So the remaining life for the facility, the total projected permitted airspace for phases 1 through 7 is 9,389 cubic yards. The remaining permitted airspace is 6,469,258 cubic yards. The cumulative remaining life expectancy, based on Santec's long-term utilization factor, is 31 years, and based off today's utilization factor is 25 years. So on to Phase 4. Phase 4 is the current operating cell where we are operating. We completed the cell in November of 2018. However, we didn't move into the new cell until it was certified roughly in January of 2019. Currently, Phase 4 has roughly 7 months remaining before we will move into Phase 5A. So Phase 5A cell construction. Phase 5A is the next cell of the landfill in which we will receive waste. We are currently constructing this cell. It will yield around 500,000 cubic yards of airspace and roughly last about 2 years. We anticipate construction will be complete in December of 2020 and then certified 30 to 60 days following. For Phase 5A, we had to move close to 400,000 cubic yards of soil. Recently, Santec entered into a agreement with or contract with Shamrock Construction to help develop the rest of Phase 5A. When they started operations, we had roughly moved 250,000 cubic yards of dirt and are going to have them finish the last 150,000 cubic yards. All soil being moved right now will remain on site and will be used for landfill operations in future endeavors. So kind of to give you all a few pictures of what the facility looks like right now, this is Phase 5A cell construction. As you can see, Shamrock has some heavy equipment on site and what they are using to move the remaining 150,000 cubic yards of soil. Phase 5 cell construction continue. In this picture you'll see on the right, Phase 4 where we are currently operating. The picture on the left is Phase 5 under construction by Shamrock, which is located directly next to Phase 4. Once Phase 5A is complete, the ingress and egress traffic will be very similar to how you see it in that right picture. And then finally, I wanted to just kind of take a look at the landfill vegetative cover. Here are a few pictures you can see of the facility. The picture on the right shows the new stormwater berm we recently installed. The picture on the left is in Phase 2. The stormwater berm currently doesn't have vegetation because we just finished constructing that, but we'll hear shortly. So at this time, I would like to just say thank you all for having me. We'd love to answer any questions you all may have.
Okay, anybody have any questions? I know Brandon and Tommy are on our solid waste committee.
Yeah, we had a very good meeting before this meeting. They gave us our yearly update, and we really appreciate the job y'all have done, and thank you for keeping us up to date the way you do. So, and it looks like it looks like as the compaction numbers go down, everything, you know, we're good to go for many years. So we thank you.
Yes, sir. Thank you all. Thank you so much.
Okay, thank you, Ben. Okay, our next item under Administrative Agency Reports and Presentations is the Valya Health Physical Monitoring Report for the year ended July 30, 2020. We have our Finance Director, Julie Davis, to report that. Welcome, Julie.
Good afternoon. You have the report here. It's a quarterly report that I'm required to present to you after they present it to me, but this is also their fiscal year end. It's an unaudited preliminary report. They have the same fiscal year end that we do. I am looking right now at the fiscal monitoring report financial statements. There are some pages of explanation that you have with them, but I'll just hit a few high spots on this one like I normally do. The total county funds that they have received are $2,898,604. And moving on down toward the center of the page where it says total revenue, $427,062,728. A little bit farther down, the total expenditures, $415,354,225, $415,354,225, to give a net income of $11,708,503, and then following on down a little bit further for total fund balance for Valya Health for June 30th, $85,912,526. Any questions that you might have might be answered in some of the explanation that they've provided.
Do we have any questions?
Okay.
All right, thank you, Julie. Okay, our next order of business will be our COVID-19 update. We have our Public Health Director, Patrick Johnson, and Medical Director, Dr. Mark Jabin, here tonight. Welcome.
Good evening.
Evening, Patrick.
Thank you for having us. I'm going to start with these two quotes. Our case number 274, a woman in her early 50s, said, "I wish more people would take this more seriously. I consider myself in good health, and I have never been so sick in my life." And then from Lisa Leatherwood from Silver Bluff Village, she said, "We have had another death this morning. We are sad and devastated by our losses. If you had told me 2 months ago that we would have 24 deaths, I would not have believed you." But that's what our death count is at this point. So ongoing and new trends. So this is what I mentioned previously. We still have people who are reluctant to share information with us. Not everybody, but we still have some people who are just reluctant. This is something that we see over and over again. Work exposure and family transmission. They get infected at work and then they transmit it to their family. In smaller and smaller, there's small groupings, which you'll see over on the new trends. We have small groupings. Not everything is at Silver Bluff or at the 2 clusters we've identified. We have small groupings that we identify. We have travel-related cases that's ongoing. We've only had 6 cases this weekend. We have seen a decrease. 2 of them, typical, travel to Florida, and they come back infected. These are the symptoms that we see over and over again: chills, sweats, fever, headache, loss of taste and smell, diarrhea, cough, and dizziness. Those are not mild symptoms. We see that repeatedly. And then cases slower to recover. That has been something that we've seen. And then I will say, now that we're seeing a decrease in cases, we are seeing better mask usage. I see it whenever I'm out. We really appreciate that. I think it's having an impact. We have seen last week a decrease in cases, and over the weekend a decrease in cases. The newer trends, we did have that really big spike at the end of July and the beginning of August. And it was because of the outbreak at Silver Bluff, and then that spread across. It got into the hospital. There was an outbreak there. And then I will explain that in the next slide about what the impact. You'll see that. We did see a decrease in the first 2 weeks of August. We're very pleased with that. We did have an outbreak here, outbreak and then clusters here, and clusters in Jackson County. If there's a cluster in Jackson County, you can be assured that there are going to be Haywood residents who are impacted also. The deaths, that's up to 24 right now. And then we're now seeing events being mentioned by people who are positive. That's what they're saying is their exposure. And we're linking smaller groupings. Necessity is the mother of invention, so when these cases spiked, we really had to make a lot of changes. And so Amy Stevens and Allison Richmond really had helped us considerably with our processes. So now we have really made some big changes with how we are managing our numbers. And then because of some vacancies, a prenatal nurse left, and so our clinic supervisor, who was one of our main COVID employees, had to start doing that clinic. We had to get some helpers in HHSA, in economic services. We've had 4 people helping us and 2 people in environmental health. We have had our communicable disease nurse resign. We've had a school nurse resign. So again, we've had to make some changes in our processes just to be able to manage the big numbers. And this will help us going forward. So, and if you take a look at this slide, this is our cases across the entire time we've been doing this up until the beginning of August, and it shows the impact of long-term care cases. What you see here is we have had cases in our community, and then it makes its way into a long-term care facility, and then how that increases cases overall. 1 outbreak and 2 clusters in Haywood County have accounted for 59% of the overall cases. So that kind of multiplies the cases, and that really shows the big spike overall in the beginning of August, and that really just was overwhelming to us. And now you see it going down, and you'll see with Dr. Jabin's slides, you're going to see even a bigger decrease. In early July, we started to look at what is really the impact on a daily basis, not just the overall number of cases, but how many people are in isolation and quarantine, which we started to call our COVID working number. And we looked back at the beginning of June, and that number was as low as 25, and then we started to see it creeping up. At the beginning of July, it was in the 70s, and then it really started to grow dramatically. It got into the 300 range, and it hit as high as 377 that 1 week, and that meant about 200 plus are in quarantine and 100 plus are in isolation. Today, we saw our first dramatic decrease. We have 104 in isolation and 205 in quarantine, or 309. So now we're going to start seeing that drop dramatically. What do I think that's all about? I do believe, I've been seeing it when I'm out and about, more and more people are wearing masks, more and more people are taking this seriously, I believe. We're starting to see the impact. I think people have seen what happens when it gets into a long-term care facility. I think people see that this is really have an impact. They know it's it's actually killing people, so people are taking this seriously. So we're really hopeful that people are taking this seriously right now, and we're seeing a decrease in cases.
Once again, thanks for having us. I think what we see in the numbers today reflects what was going on in the last 2 weeks. And likewise, what we'll see going forward will depend on what happens in the next couple of weeks. So I think there's a couple of insights from the Silver Bluff story that might be helpful for us all. It certainly has been for me, which is that despite the best of intentions, someone brought that into that facility. They weren't being bad, they weren't being negligent. In fact, they were probably exposed to someone in their community who was in a pre-symptomatic or asymptomatic state, who didn't know they were infected, gave it to this person who came to work. They didn't know they were infected, and it got into the facility. That doesn't mean anybody's bad here. It goes to reflect how difficult it is to deal with this virus. Prevention works, but it will not be enough to get rid of the virus altogether. No policy or procedure will drive the risk to zero, but over the past 6 months, we've learned a lot about what reduces that risk. There's also something good to come out of the Silver Bluff story. So, despite 150 residents and staff being infected, there have only been around 8 family members of those staff who have also become infected. So think about that just a second. Early March, it was said that when there were 15 cases in the country that this would go to 0. 15 became 5 million. In this case, 150 cases became 8. 15 cases to 15 million, 8 cases, 150 to 8. And I think what that represents is that isolation and quarantine work. If you think about this, despite the pain and suffering of the people who died and the family members of those people, if we look at this from a community perspective, the tragedy at Silver Bluff does not look like it's going to translate into a tragedy for Haywood County and the community. And that was thanks to action and diligence and attention to what works. So, in this case, prevention didn't prevent that outbreak, but isolation and quarantine did. They filled the gap when prevention was not enough. And there are some in our community who have opted out of contact tracing, who have been identified as close contacts. And I hope that those people are still quarantining themselves but just don't want to be contacted, because that really becomes the key when prevention is not enough. You know, we're not here to bust people, we're here to bust the virus. There are those, however, who want to tell us that this is no big deal, it will magically go away, and yet we can see with our own eyes that maybe our experience or your experience or the experience of somebody close to you doesn't quite fit that belief. This slide really points out from the statewide data and from our local data what we've seen. And you can follow the curve and see the big spike. I think the important thing about the big spike is that although Silver Bluff and the hospital contributed to that, that was by no means not the entirety of the spike. Roughly about 50% of the new cases were not related to either of those. And I would also point out, excuse me, today I heard from the hospital, they have had no new positives from any of their staff for the past 14 days. So once again, there was the potential for widespread outbreak that was controlled by isolation and quarantine. This is a slide that points out risk levels, trying to help communities know where they're at. This is data that's largely from the Harvard Global Health Initiative. And I'll tell you that if you can see right there, we're in yellow. And I can tell you that up until today, we were in orange or red. And this is a slide that I think really sort of gives us some insight about where we have been, where we are, and where we're going. You'll notice that green line at 6, hold that, we'll come back to that in just a minute. But as you can see, If you look at April, May, June, and July, then we had our big ramp up. What maybe doesn't come through quite so well is we had a bit of a spike late April, early May. We got that sort of tamped down. We had another spike sort of early June. That got tamped down. And then you see July and sort of the steady upswing until just a few days ago. And I'll tell you that on our policy group meeting 10 days ago, we had a conversation about what was going on. And 10 days ago was almost the high point of that spiking curve. And what Patrick and I were sharing with folks on that call is we didn't know where this was going to go. We were very concerned. We know that what people do over the past 2 weeks determines what's going to show up in the next 2 weeks, and we didn't know whether that curve was going straight up or flat or down. Saturday, I did my video for the weekly update, and I can tell you that that spike had started to come down. We had been at, and I should say this is a graph of the number of new cases per day per 100,000 population, okay? So that's kind of a weird figure, but that's what they're following. And what you should also know is that from the White House task force criteria, anything above 14 is considered red zone. From the Harvard criteria, anything above 25 is a red zone. They have a yellow zone above 10. So if you can keep that in mind. So Haywood County at the peak of that spike was about 27. That's above 25. At that point in time when we were having this policy group call, Haywood County was in the red zone by any of the criteria. High risk situation. So a week later, I'm doing my video for the update of last week, and I went to the numbers. This was on Saturday. We had gone from 27 to 25, and on Saturday we were at 17. If you look at that video, which I just think went up today on the Mountaineer, and I looked at the data today, it's 8.3. Dramatic drop. I don't think any of us were expecting that. We're extremely pleased that that's the case. But what that reflects is what we have been doing in the community over the previous 2 weeks. And frankly, that's given us a window of opportunity. Now look at the green line, that's 6. So where do we go from here? And I think one helpful metric may be school openings and what's required for school openings. And if you look at the data from across the world at places that have been able to open their schools safely, then it really depends not so much on the individual actions that the school takes, it depends most entirely on the prevalence of disease in the community, such that communities with higher prevalence were not as successful, places with low prevalence were. So what is low and what is high? It has been recommended by University of Nebraska, MITRE, and some other groups that you should be below 1 per 100,000 population, new cases over a rolling average over a week. There are others who say that number should be less than 10. So somewhere between 1 and 10. At 1, they're saying, below 1, they're saying schools should be able to open entirely and be safe. Below 10, with some modifications. The farther we can drive this down, obviously the better it's going to be for schools, and that translates into the economy, and that obviously represents health. So we have a window of opportunity right now. Look where our curve is going. We're down to 8.3. We need to get below 6. 6 represents 10 per 100,000. Our population is 60,000, so that would be 6 of that. So that's our marker right now. The more we can drive this below 6, the better it's going to be for all of us. And I think there's been a lot said about our rights and our freedoms not to do things. But here's a situation where we also have rights and freedoms to do things. And, every tradition emphasizes good action, action for good. And with this pandemic, we know what that action now means. It's the things that we've been hearing most recently from public health, 3 W's. In Haywood County, we're talking about show a COVID IQ, which is isolate as soon as you get sick, quarantine if you're asked to do that, and if you're a close contact. Follow the golden rule of gathering. Gather together as you would have others gather with you. And I would ask people, if you don't want to do all that, that's fine. But the bottom line for me is avoid crowds. And if you can't avoid a crowd, put a face covering on. I think that if you look at our experience around the world, around the United States, and now around Haywood County, I think that you can see that whether you believe it works or not, it's making a difference in terms of these numbers. And if we can't prove it, why not do it if it's going to help? So I think the most impactful thing we can do right now with respect to COVID is to drive the cases down. If nothing else, it'll help us be in a much better position to weather the next spike, because there will be more spikes. I think we've said this all along. There's going to be rolling waves here. We've got an opportunity right now. I wasn't sure we could get back down to this point, but there you see the numbers for yourself.
Thank you, Dr. Javen. Dr. Javen gave a talk to the chamber about a week ago, and he came back with this award. We were really extremely pleased to get this award. We didn't even know we were eligible for this award. It was a great morale booster for the health department and HHSA across the entire agency, and I just wanted to share it with everyone. We were really, really pleased to get this award, so I just wanted to share this. So if you all have any questions.
I just have a comment. I noticed there, I got an email about Smoky Mountain News ran an article about y'all staff and about how hard y'all have worked during this pandemic and really put in a lot of extra effort and a lot of hours. And you know, this, I hope, is a once-in-a-lifetime event. I hope we don't have to go through this again, and I hope the trends continue, as you've pointed out. So just want to say thank you for all the hard work that you and your staff and everybody's done during this. And the sooner this thing's over, the better. So I know y'all will agree with that. So it's been a strain on everybody, and my heart goes out to everyone that's lost loved ones. And I have close friends that's lost loved ones to this, and I know people that's had it. And I know somebody that could say the same thing you put on your overhead right there. A woman I know is in her late 50s, and she's been healthy, and she told me, she said she had been so sick she couldn't get out of the bed for 5 days with this. And so, you know, just again, I want to just say I appreciate everything y'all have done, all the hard work you've done for our county during this time.
Thank you, Tommy. I would just like to say that, you know, the folks at the health department have just been doing the heavy lifting in all this, and their recognition is well deserved. But I also want to point out that I think to this community, I mean, we just had a big outbreak and a big spike that could have gone other ways than it's gone right now. And I just want to thank everybody in the community, those of you here, for doing your part to help that happen. That didn't happen on its own. That happened because people acted. That's because people took ownership of doing the things that we know will help. And so I want to just thought I'd thank you to the community as well. So, other questions? No?
I don't have any questions. I concur with what Tommy said. I know that's been difficult at the health department with the workload that they've had to carry in regards to this and following things up and doing what needs to be done to try to control it. And there's no question it's certainly a real disease. I think there were some questions about the fact that whether it was or not at first, but and you know, I've come around to certainly believe, and I think I said that 2 weeks ago, that the masks really do help. And matter of fact, I was sitting here thinking it was akin to yesterday when I went out and weed eated, and I generally wear something on my face. And if I don't, I come in and make sure I put the mineral spirits and stuff on my face. Well, I didn't do it immediately, and I didn't wear a mask, and now I got the poison oak, and I get it about every time. And so I wear the mask to prevent that from happening. And so I think it's been good that folks have been trying to wear their masks more. And I know people are against that, and I'm certainly not about the government telling people what to do, but if you want to protect yourself and protect others, and I think the key is, you know, protect others, not necessarily as much as yourself from spreading, because it does spread. If you don't do it, it spreads, and then it causes problems, and it causes economic problems. You know, it's not as much. It does prevent death, and you worry about that, but it just changes your whole life if you don't try to. If this continues to go and spread, it changes the way we live, and so it'd be nice to try to stop it as soon as we can, so we can get back to living to normal.
I just wanted to comment too, talking about people wearing masks. A lot of times I get out of my vehicle to go in the store and I forget my mask, and I know people wearing their masks because I get reminded when I start to walk in, I see somebody with a mask, and I know I've got to turn around and go back and get my mask. So people are reminding us by wearing masks that we need to wear a mask because they're coming out of the stores with them, and I see them in the stores with them. So I really think it's good that that's happening because, it's a reminder to people. And I'm just reminded, Jesus said, do unto others as you would have them do unto you. And I think that's so true in this case because really by you wearing a mask, you're really protecting others more than you're protecting yourself. And that to me is the bottom line is, doing unto others as you'd have them do unto you. So, but thank y'all. Thanks to the health department for all the work.
The final thing I'd like to say, Kevin, is just thanks to you guys for supporting what's going on in the county and being a consistent voice for that. So much thanks to you as well. Really important.
Hey, before you run off, I do have a question for one of you. I know that we talked about the numbers and the decline, and it's starting to come down, which is good news. Have you still seen that over the last couple of days, Patrick or Dr. Jasmine?
Yeah, I think, really the big switch was really the beginning of last week. All of a sudden, we started to see that decline, and that's held through this week. I'll feel a whole lot better a week from now when we get 14 days out because, of course, it takes 14 days to really know the impact. So if we're having this conversation next Monday and it's still staying at these numbers, then I think that we can say we've weathered this spike and let's get ourselves in a good position for the next one. Yeah. Thank you.
Thank you all. Okay, our next item of the administrative agency reports and presentations is tax collections, and we have a tax collector, Greg West. Welcome, Greg.
Thank you, Mr. Chairman. Good evening, Commissioners. The historic courthouse has been closed to the public since March 20th due to the COVID-19 virus. During this time, the second floor staff has been waiting on the public at the front door. This has been a little challenging at times, but we appreciate all the citizens' patience that we've dealt with here at the front door at this time. So we are now entering our most busiest time of the year. So we're going to be opening the second floor of the courthouse to the public around the first week in September. In order to keep everyone safe as possible, we'll be making some changes in order to enter the building. These changes include masks being required to enter the building. There will be temperature checks at the front door to make sure no one has a fever. And the hallway will be marked off for social distancing so that we can keep this COVID spread as small as we can. We've not had any of our staff members test positive that I'm aware of, so it's due to the fact that we have been wearing our mask when we meet the people at the front door. But we just can't do that with the tax bills going out. You guys know that sometimes we have long lines, people waiting in order to pay. And so we've made a few changes as well to that. We're going to be inserting an insert into the bill that gives all of our payment information on here. You can mail those payments to 215 North Main, also to our Charlotte Post Office box. You'll be able to pay via online at haywoodcountync.gov, taxes/pay online. You can pay over the phone with our 1-800 number, 1-877-729-8290. Please do not mail cash in your payment. We're also installing a payment drop box that will be located at the front entrance of the Haywood County Courthouse. Please do not put cash in the drop box. Taxpayers that have more than 10 bills require quite a bit of time, so we would like to ask those taxpayers to call the office and make an appointment. We'll be glad to sit down like we normally do and make sure to take the time to get it right. This is something we've been working on with our Director of Operations, Chris Boyd, and our County Manager, Bryant, to try and keep our staff as safe as possible as well as our citizens. during this time. So we know this COVID thing is ongoing and changing as it goes, so we're flexible going forward. These changes, we'll be making changes as we go along to best serve the citizens. So I'll be glad to answer any questions that you might have.
So we're going to be able to open, the second floor is going to be open with these requirements for them to come in and pay their tax bills.
That's correct.
Okay.
They'll also be able to go to the Register of Deeds, Assessor's Office, and Land Records.
Okay.
As well, as long as we're able to social distance.
Okay. Yeah, I think that needs to be done. I mean, I'm up here often, and it's difficult for the people on the second floor to do their job with people not being able to go back to those rooms. And so if we can close it off to allow at least those departments to be able to see those people, or at least the people that want to come in. I mean, obviously, there's not as many people that want to come into certain places if they don't have to. And so if they have those options, the other options to pay, I'm sure they'll choose to do that. But there's going to be a few people, if they have cash, they want that receipt. And it's important to provide that receipt to protect us and to protect those folks. I mean, several years ago, we had issues with that, with cash that had gone missing with the tax collector, and we don't want to do that again. So I appreciate the fact that we're trying to open up the second floor in order to make sure that it's safe.
Do you ask the questions when they come in? If I know where I work, every morning they ask me the same repetitive questions. Have you had a headache? Have you had a cough? Have you had a fever? Have you been in close contact with anyone that's had a test? There's a series of questions that we have to answer, before we can enter the facility. Do we have any protocol like that here? When someone comes in to pay, naturally we wouldn't want to bring someone here that's got a high fever or coughing.
Greg had mentioned we're looking into, I think it's called a CT scan device that will be a camera that I guess it's infrared in some way that will take instant temperature, so we know if they're running a fever. We haven't talked about the questions, but that's something we certainly look into. The fever and wearing a mask is going to be the key to keeping it medicated.
I know we've been down this road so long, sometimes people get complacent, but nobody wants to be, infected and infect others. But it's just always good to remind people, that, hey, if you have the symptoms, stay at home. And, it's always good to remind people of that. And we want to ensure other people's safety as well as our employees and other people coming and going. So you might look into that.
I believe it'll be safer for the staff as well as the citizens to let them in the building, because we've been out front, face to face, and some folks, of course, not wearing masks, and we're not able to social distance out there, and the wind's blowing around, and we've been taking cash payments out there. It's not the most secure spot to be doing that. So the staff, as well as, we feel it's safer to let them into the building, social distance. We have tables put in front of our counter that keeps you the 6 feet. Chris has installed sneeze guards in all of our offices. We have plexiglass up now in front so that we can guard against sneeze and air droplets going across. It's not perfect, but it is better than nothing. And it's going to be busy, and we certainly appreciate everyone's patience, and we'll do our very best to give the best service that we can.
I mean, from what I've seen, the precautions that have been installed are better than a majority of the public places that I go. So I think if we can enforce those guidelines, I think that these folks will be safe.
Part of it is out of necessity because we have such small offices. If Sherry's office and Register of Deeds, one was to get it, it's likely they all would. So we've been very careful because it could wipe out not death, but it can take an office and shut it down for a couple of weeks, and we can't afford that. So we've been very cautious, and hopefully this approach keeps the virus from hitting staff in our courthouse.
Okay. Does anybody have any other questions for Greg? Thank you, Greg.
Thank you.
Okay, our next order of business is adjustment or discussion of agenda, and I have nothing. Does anybody have any discussion or adjustment of agenda? Okay, our next order of business is the consent agenda, and I have several. I'll just move through these. If you have any questions at the end, we'll come back. Our first item of the consent agenda is the request approval of the August 3rd, 2020 regular meeting minutes. Number 2 is to request approval of the July 2020 refunds, releases, amendments, and discoveries. That's under attachment 2. Number 3 is to request approval of the July 2020 tax collections, updates, and refunds. That's under attachment 3. Number 4 is to request approval for public fireworks display at Chestnut Ridge Event Center on August 29, 2020, September 3, 2020, and September 19, 2020. That's under attachment 4. Number 5 is to request approval of refund of excise tax overpayment in the amount of $110 to be paid from the Register of Deeds excise stamp tax account. That's under attachment 5. Number 6 is to request approval of the revised memorandum of agreement between the USDA Natural Resources Conservation Service and the North Carolina Department of Agriculture and Consumer Services Division of Soil and Water Conservation and the Haywood County Soil and Water Conservation District and Haywood County. That's under attachment 6. Next, number 7 is to request approval of a resolution of the Haywood County Board of Commissioners authorizing the negotiation of an installment financing contract and providing for certain other related matters for 1, the purpose of building a health and human services building at Haywood Community College for classrooms and labs for the nursing education program, and 2, to refinance of an installment financing contract with Bank of America N.A. dated October 1, 2010, and that's under attachment 7. Number 8 is a series of budget amendments, is to request approval of budget amendments for fiscal year 2021 from the General Fund, Emergency Management, $82,624 to appropriate federal PILT funds from the fund balance received after the beginning of the fiscal years to pay for responses on federal land. Next is from the General Fund, the Library, $3,630 to accept and appropriate state library funds for the purchase of wireless hotspots to be loaned out through Waynesville and the Canton libraries. That's under attachment 9. Next is the General Fund, Public Safety, the Sheriff's Office, $119,487 to reappropriate the cost of vehicles ordered by the Sheriff's Office that did not arrive by the end of fiscal year. That's under attachment 10. Next, from the General Fund, the Health and Human Services Agency, Health, $32,057. Federal CARES funding from the Division of Public Epidemiology for prevention and preparedness for the coronavirus response, under attachment 11. And the last one is from the General Fund, Health and Human Services Agency, Health Dental, which is $20,000 local funding from the Haywood Healthcare Foundation to provide critical dental care to indigent patients at minimal cost to citizens in need. That's under attachment 12. Does any commissioner have any questions on the consent agenda? Hearing none, I'll entertain a motion. We approve the consent agenda as presented.
So moved.
Is there a second? Okay, is there any other discussion? All those in favor signify by saying aye. Aye. Okay, anyone opposed? Okay, it's unanimous. Okay, next we'll move to our order of business is the regular agenda, and we'll move to the request approval of order of collections. And Greg, we've got you back up again. This is under attachment 13.
I'm here to request approval of the order of collections for the year 2020. This is something that we do every year. You guys have to give us the permission to do our job.
Anybody have any questions for Greg? This is something, like you said, we do every year. It's a yearly ritual.
So moved.
Second.
All those in favor indicate by saying aye. Aye. Anyone opposed? Okay. That's unanimous. Thank you, Greg.
Thank you.
Our next order of business, our next item of the regular agenda is to request approval of a contract with the North Carolina Harm Reduction Coalition, which is responsible for assisting Haywood County in meeting community linkages to care grant requirements in the amount of $77,360 to be paid from grant funds, and approval for Haywood County Manager to sign said contract. And we have our Health and Human Services Director, Ira Dove, and Health Education Supervisor, Megan Hauser. Welcome, Ira and Megan.
Thank you.
And that's under attachment 14.
Mr. Chairman and Commissioners, members of the public, thank you. Thank you. I also, before I begin, would like to thank, a little closer, all right. It's been a while, so thank you. I would also like to thank Michelle Mathis, who is here. She is the Interim Executive Director of the North Carolina Harm Coalition, as she has come here tonight in case you had specific questions for their group. But she has traveled here from Hickory, I believe. So with that, let us begin to talk about this topic. We have a grant, and the grant cycle, we're in phase 2, would actually run up to 33 months, full setup. The grant would be used to maintain current levels of post-overdose response, and mobile syringe exchange, expand the capacity to link justice-involved persons to care, continue outreach in post-overdose response, and increase linkages to care to treatment resources, transportation, housing, employment, and other services. Those are the things that we are supposed to work with. The grant fund stipulations, some things the grant may not be used for. Can't use it for syringes, hypodermic needles, cookers, fentanyl test strips, or medications. Couldn't run a prescription drug take-back program with the grant money, or clinical care, or any direct medical service. This is a linkage to care grant. So what could we use the grant for? Salaries and certain costs related to staff, such as mileage and phones. Can use it for housing-related needs, and that would be for the clients of the grant, transportation for clients, training, and that could go to either the clients or some of the other folks who are working with them in different areas like naloxone and naloxone distribution. It can also be for syringe services program, care items such as alcohol wipes, bandages, hygiene products, and food. The deliverables under the grant, the staff to carry out the duties in the agreement, the evaluation of community activities for all the different strategies, the implementation of certain strategies, and I'll discuss what those are in a minute, and uphold certain performance standards in the way that this is done. The activities have to be evidence-based, culturally sensitive, and at the appropriate academic level to accommodate stakeholders, and trainings by the individuals. And I'm going to stop here for a minute and just chat about some of the things in the deliverables, because one of the questions is, well, how would we measure what you do? One of the ways you can measure is actually the linkages to care. We could talk about how many needles, and that's one of the things we report to the state. We can talk about how many people we train in naloxone. That's one of the things that gets reported to the state. We can also measure how many people we link to the different types of care. How many people do we link to HIV testing in the next 6-month period? How many people do you link to hepatitis testing? How many people do you link to getting vaccinations if they want it? Now, I'm going to use two different terms. One is referral. That's basically I tell somebody something's out there. That's referral. And the other is a linkage. That's where I say, it's out there. If you need transportation, I'll help you get it. I'll call them if you're uncomfortable. I'll provide that next level of service. So if you're really committed, you can get there. So if you're looking for a measurable from my thought process for this grant, you look to the different linkages to care for how we go. Some of that was inhibited in this last cycle, and we had those conversations with the state and with harm reduction because of COVID. So one of the things we're going to have to do is be creative is how to link people with these different resources in the age of COVID. But to me, that's what this grant is really about. That's the heart of it, and that's how we all need to measure success. Core strategy number 1. This is the Expand Syringe Services Program. Well, syringe services programs are an evidence-based strategy. This is totally counterintuitive. And candidly, I've had the ability to look at some of this for quite a while. First heard of these things going back before they were legal, because they were using them to stop HIV, and they were legal in other states. And so these discussions, and it takes a while to wrap your head around this particular thing, because it is completely counterintuitive, and it's kind of counter to a lot of what you would understand about substance use. And when you look at what happens when they started looking at the studies, it doesn't make sense. A lot of what people have said here tonight would make common sense. So I'm going to tell you, some of this doesn't make common sense, but it works. So that's why I can completely understand people coming up here and saying an opposite point of view, because it takes a while to understand what we're doing and what the state is saying do when you're out there handing out needles to reduce the supposed harm, and you're handing out the alcohol swabs and the other things. Now, I'm going to give a little background on syringe services, and I'm going to focus a little here more because it's been so much the topic. It's been the topic of your calls, it's been the topic of the papers. That's not totally what the grant's about. It's really about linking people to care in other regards, but part of what one of the positions does is this particular service, so I feel I need to stop and spend a little more time on this for everybody. They've been legal in North Carolina since 2016. These are run under the North Carolina Department of Public Health Injury and Prevention Branch, and I've actually had conversations with those persons related to our program and to these programs in general. They operate directly in about 42 counties and on the federal tribe, and indirectly, meaning that other counties are served, 38 counties are served by the ones operating in those counties. And those are state statistics, 3.3 million syringes, 35,000 naloxone kits. That's one thing they're doing. And I'll talk in a second, because I've had some conversations with Michelle Mathis about some of the philosophies and what may work better for us, and I'll get into that in just a second, but that's some of the basics for North Carolina. 30-year history of looking at effectiveness, about a 50% decrease in HIV transmission, and here's what's completely counterintuitive. 3 times more likely, if you have these things and people use them, to stop injecting drugs. And that's what we really want. That's what the CDC says. And that's one of the main things, and it's completely counterintuitive. You would think if you supply clean needles, people may just keep using them, but sooner or later, something may click, something may get out there. The other thing that's completely counterintuitive is if you have a syringe service program and you hand out needles, they see about an 86% decrease in the total litter. Now, you heard some of the things that are happening here, collecting the laundry jugs and handing them out, handing out the, they bought a few, I think, basic syringe collection boxes. But mostly they're handing out laundry jugs that people collect. And the other thing is they're saying, we'll pick them up. You can call the police office if you find these needles. You can call a number that they have, and they'll pick them up. So that also will reduce this syringe litter. And again, completely counterintuitive. You would expect the opposite result, but that's what the CDC has shown, and the people here are willing to work. Core strategy number 2, because there are 3 core strategies. We've had a lot of talk on this grant about the first ones, but there's actually 3 main core strategies, and this is one of the ones that we really want to hone in on.